Welcome to the Nurse Becoming podcast. I'm your host, Amanda Guarnieri from the Resume RX, and this is the podcast that's dedicated to empowering and encouraging nurses along your path of professional and self-discovery. As a nurse practitioner, mom, and business owner, I'm on a mission to help you figure out how to leave your lasting impact on the world, all while bravely and fearlessly growing along the way. Join me for honest conversations and inspiring stories about personal and professional growth, all through the lens of nursing. Hey, real quick, before we dive into the episode, I want to let you know that this episode is a feature from one of our NP Specialty Takeovers episodes. What we're going to be doing is over the next few months, we're going to be featuring 4 different NP specialists giving a behind the scenes look into their career, how they got there, what they studied, kind of how they emerged into the specialty. Now, you'll hear 4 of these episodes here on Nurse Becoming, my regular public podcast. However, if you want to hear all 10 of the Specialty Takeovers episodes and hear them right away, because they're all available right now, I have them inside of a private podcast feed that I would love to share with you. So if you head to nptakeovers.com, that's nptakeovers.com, you can enter your email address and for free get access to this fun private podcast feed with all 10 of the NP Specialty Takeovers episodes. So I hope this is helpful, and let's dive right in. Hello, Amanda here. Welcome to the NP Specialty Takeovers series. I am really excited to feature some colleagues of ours in the nurse practitioner world who are working in specialties and who I've invited on to this special series to share a little bit about them personally and what their path was, how they got into their specialty, and basically a behind the scenes of what their day-to-day life looks like working in the specialty. So I am super excited for this. What I did was a while back, I put up a question box on Instagram and asked my audience what specialties you would like to learn more about. And I got so many responses. Thank you if you are someone who submitted a suggestion. And what I did was I went through and I tallied them all up, and I chose the 10 most popular or the 10 most frequently suggested specialties, because those are the specialties that you and my audience are wanting to know more about. And that's how I chose the specialties that will feature in this Takeovers series. So you will, in a little bit, hear from one of our Takeovers guests. And just so that you know, the way that we recorded these as an asynchronous interview, meaning that I gave questions to our guests and they recorded their responses. So rather than a back and forth conversation, what you're going to hear is some stitched together audio from our guest answering the questions that I posed to them. So it should be pretty easy to follow and should basically come across as a narrative of a behind the scenes look at this person's day-to-day life and how they got into their specialty and what they recommend for future people who are interested in the specialty. So like I said, I'm very excited. I really want to know what you think about this. I hope that you enjoy this kind of new way of seeing into the lives of everyday nurse practitioners like you, because I really think that in order for us to make good decisions about what direction we want to go in with our career, we need to have this exposure and we need to learn about what's available to us in the workplace. And especially if you've had, just a handful of clinical experiences or they were all focused in one area. You may not even have ever been exposed to some of these specialties. So hopefully this gives you more information that you need to make good decisions about what is next for you. So we're going to dive right in. I hope that you enjoy this interview, and I can't wait to hear what you think.
Who are you and what do you do? Hi, my name is Tempesst, and I am a psychiatric mental health nurse practitioner working in outpatient psychiatry. How long have you been working in this field and how did you get into it? So I have been board certified and working as a psych NP since March 2019. Before that, I was a psychiatric RN for about 2.5 years before going to a psychiatric mental health nurse practitioner MSN program at Vanderbilt University. What is your APR and specialty? Did you do anything in school to emerge into the specialty you're working in? So my specialty is as a psychiatric mental health nurse practitioner, and I have board certification as a psychiatric mental health nurse practitioner across the lifespan, which means that I can treat psychiatric disorders in children all the way up through older adults. I knew that I wanted to go into psychiatry before I started NP school, which is why I specifically applied to a psych NP program. What is your typical day like? How many patients? What type of setting? So right now I am working as a locum tenens nurse practitioner, so essentially a travel nurse practitioner in an outpatient psychiatry department at a federally qualified healthcare center in Washington State. So at this assignment, I'm seeing mainly new patients. So I'm seeing anywhere from 3 to 4 1-hour psychiatric evaluations per day. And the psych evals is what you do when it's your first time seeing a patient as a psych NP. So we go into the full psychiatric history, social history, medical history, family history, and then from substance use history, et cetera. And then from that, we formulate a diagnosis and then decide on a treatment plan. So I'm doing anywhere from 3 to 4 of those 1-hour appointments per day. And on some days, I have follow-up. So patients that I have started on a treatment plan who are coming back so that we can see how they are progressing. So Washington State is a full practice state, so I do not have any physician oversight. However, the physicians at this clinic are very warm and approachable. So if I do happen to have any questions, I can easily go to their office or send them a Skype message. And as far as collaboration, I'm mostly collaborating with therapists. So we talk about how our shared patients are, progressing towards their overall goals. Really important that most patients are involved in therapy because medications do not work in a vacuum. And then of course I collaborate with nursing. They do my vitals, prep the patient, case management type things. What is your work schedule? Tell us the details of your hours, weekends, holidays, etc. So right now at the assignment that I'm doing, I am working Monday through Friday, 8 to 5, with a 1-hour lunch break in there. So typical business hours, which is pretty typical for psych NPs working in outpatient psychiatry. Some prefer to work for 10-hour days instead of 5 8-hour days. That is typically prefer to work 4 10s if that is an option for the place where I am working. And many psych NPs work part-time. They might work Monday, Wednesday, Friday, 8 to 5 or something like that. So because outpatient clinics operate during normal business hours, they are closed on evenings and weekends and holidays. However, they usually are open on New Year's Eve and Christmas Eve. So on these days, what I've found in most places that I've worked is that the clinic is open a half day on those days. And then we decide at the beginning of the year or at a different point in the year, we decide, who will be working those half day holidays. And it's usually decided on a like rotational basis. So if you did it one year, you probably won't have to do it the next year. Would you say this is a high, medium, or low stress environment? So I would say that psychiatry is a high stress environment. Right now, I'm working at a FQHC in a city where there are not a lot of psychiatrists or psych NPs. So there are a lot of patients who need to be seen that not only have, mental health issues, but most of the patient population here have comorbid chronic medical conditions as well. Psychiatry is one of the specialties that is most prone to provider burnout, not only because the subject matter is quite heavy, but also because there is a shortage of psychiatric prescribers. So, in some cases, in a lot of cases, we're expected to see a lot of patients per day. I would say that the stress level gets lower, probably down to the medium level if you are in private practice and you're able to, more so control the type of patients you see, how long you get for appointments, your policy on certain medications, things like that. What is your favorite part about working in the specialty? So my favorite part about working in psychiatry is getting to see the improvements that patients make over time. So, whether it's somebody who was flurriedly psychotic and helping them get, on an effective antipsychotic regimen that now helps them to be able to, hold down a job or engage with their family or engage in community resources, or, somebody who was majorly depressed and suicidal, seeing them smile, seeing their affect brighten is very rewarding. What are some desirable skills for those working in this specialty? So, desirable skills for working as a psychiatric nurse practitioner, first, I would say empathy. We are working in psychiatry, so it is important to be able to understand how a patient is feeling from their own frame of reference. Effective interpersonal skills, effective communication skills are going to be really important because we can't just jump into asking about a patient's psychiatric history as soon as they walk through the door. We do need to build that rapport not only in the first appointment but over the first several appointments so that we can develop and hone that patient provider relationship. And I would also say, being an effective team player, being able to effectively communicate with people from multiple different disciplines, because like I said before, these medications do not work in a vacuum. And with psychiatry, there's, often psychosocial and medical factors at play. So we do need to be able and willing to collaborate, with therapists, with nurses, primary care providers, specialists, social workers, caseworkers, the patient's family, and so forth. So for students who are interested in going the Psych NP route, or for other nurse practitioners who are wanting to transition to being a Psych NP, I would recommend connecting with current Psych NPs, seeing if you can shadow them at work for a few days, or even just meeting up with them for coffee or over Zoom, so that you can really pick their brain about what their day-to-day work life is like. Yeah, so I'd say, for my new grad psych nurse practitioners out there, keep in mind that the brain is the most complex human organ there is. So definitely remember to give yourself grace during the transition process from student to practicing psych NP. So you can connect with me on Instagram at Tempest, the PMHNP, Tempest with two S's, or on my website, which is tempestthepmhnp.com.
Well, that does it for today. Thank you so much for tuning in and making it all the way to the end. If you found today's episode helpful, would you take a minute and give me a rating or review on Apple Podcasts? It will truly help other nurses find this show and know that it's worth listening to. For more information about this episode, as well as a place to submit your questions or suggestions for future episodes or guests, head to nursebecoming.com. I cannot wait to connect with you again soon. And until next time, remember, I am always rooting for you.